And I wouldn't say that those failures led me to just be like, I can't be monogamous anymore. If the right person and situation came along, I would be fine with monogamy again. I mean, I did it for 40 something years. Um, but polyamory has allowed me to explore some really interesting people, get into different desires that I have, enhance my emotional intelligence and communication like 100-fold. Um, and it's helped me to reflect on some of the mistakes that I've made and some of the challenges that have led to the demise of my monogamous relationships up till now.
Mm.
Um, and it really almost all stemmed back from communication and the lack of it, fear, shame,
Mm.
um, and not being honest and open.
All right, Dr. Carey, thank you so much for joining us. I really appreciate it, and I'm so excited to learn more about your journey. So, I'm going to go ahead and hop right in. So, essentially, you mentioned in our pre show notes that you experienced a moral injury, which ultimately triggered the notion for you to walk away from your career. So, I want to take the time to really walk through that experience and how you came to that conclusion.
Oh my goodness. Well, in emergency medicine, I mean, the typical thing is burnout, but we're learning that it's a lot more than that. And so the moral injury was definitely coming from many years of seeing people at their very worst, their worst moments, tragedies, catastrophes, handing out bad news on a regular basis. Um, People who were very ungrateful, whether it was staff, patients, or my actual colleagues. The microaggressions were really consistent from my being a Black woman. So I had three things going against me. One, I didn't have a penis. Two, I had pigment. And three, I was very young looking. And so most people didn't realize I was their physician. I definitely was disrespected. And so it was just constantly being beaten down, honestly. Um, and so I was already fairly burnt out prior to the pandemic. And then once that hit, um, those microaggressions got really big. They weren't filtered out by good experiences because we were seeing so few patients. And so the patients that we were seeing were either really, really sick, dying. It was scary for us, obviously, as the practitioners, because we were not vaccinated yet and nobody knew how it was actually spread. And so, we would have nursing homes empty, 38 people because one person got COVID and three people were sick during the pandemic. And they would just drop everybody off at the emergency department and shut their doors and go home. And I don't necessarily blame them for that because there was no there was nobody knew what to do. There was no recourse, there was no protocol, there was no plan, for what to do in those cases. However, we also did not have a plan to receive dozens of people at once, a bunch of which were already sick, most who were infirm, and our staffing had gone down a lot. And so the pandemic really pushed ahead the fact that I was physically and emotionally and spiritually unable to do my job anymore.
Hmm.
Um, so yeah, push came to shove about 6 or 7 months into the pandemic, and I realized that I couldn't go back to work for a little while. So I took a sabbatical, and once I stepped away from it and started to look at it from the outside, I realized that my quality of life had been suffering for a long time, and my child was a teenager at that time, and I knew I wasn't the mom that I wanted to be. I wasn't the partner or the daughter that I needed and wanted to be. So, yeah, I wasn't able to go back to that particular part of my career. I did end up going back into the emergency department, a new hospital that had just opened up in my area. I went back for a year, April 4th to April 4th,
Mm.
and it took me all of 3.5 minutes on my first shift to realize, "Oh, this is not healthy. This is not good for me. This is a mistake." Um,
Mhm. I see that
yeah,
happen
I was
often, really kinda
whew.
going back and seeing if something's going to change. So, we failed to mention that you actually were an emergency medicine physician. So, talk to us about what inspired you to become a physician and how did you get into emergency medicine?
Well, that's funny. So my prior career, I was an athletic trainer, and so I was already, in the medical field taking care of athletes. Um, but I knew that there was something well, the quality of life and the professional sustainment for athletic trainers is really low, because you're on the road all the time. You don't have much of a stable family life. And so most of us knew we were going to need to go on to do something different. And I had already worked in a physical therapy office a few different times and had realized that that was not my calling, that I don't have the patience for that. And so I had talked my roommate and another good friend of mine who was also an athletic trainer into going to medical school. And so then after they had decided they were doing that, they turned around and said, you're coming with us. And I gave them all the same arguments that they had given me, which was pretty funny. So they talked me into going too. And I did end up going to medical school with my roommate from undergrad. And so we've been together for over 35 years. Um, and I thought I was going to be an orthopedist. That was the plan, was that's kind of the transition. Athletic training, you become an
Right.
orthopedist, you
Right.
do a fellowship in sports medicine. Ta-da, right? You're right back in the throne. Um, but somewhere in my last year of medical school, I did a rotation in emergency medicine only to rub shoulders with the orthopedic, program that was at University of Arizona, which is where I really wanted to go. And 3 days into my rotation, I called my dad sobbing, like, "I think I've made a huge mistake. I really like this, and these people are really rad." And he's like, "You haven't done anything yet. Like, what's the
Yeah.
mistake? What are you doing?" And so that's how I actually bet on a Monday Night Football game and decided emergency medicine over orthopedics.
So
Don't kids, don't do
why
that.
didn't you like, orthopedics?
I loved orthopedics. I have really good hands. I love procedures. I liked the OR. And that was the difference was somebody said, "If you are not in love with the OR, if that is not a place you could see yourself like 70 hours a week in the operating room, then you probably shouldn't be there," which imposed a little bit of doubt in my head. And then knowing that emergency medicine, I probably have a lot of ADD, and I really like the fact that you could just see a little bit of everything and
Mm,
all different people, tons of diversity, and still be surprised on a regular basis and learn
mhm.
something new. I think that's what called to me the most.
Got it, got it. So
Yeah.
the long 70-hour shifts or, stints in the OR, you didn't really envision yourself doing that, so you wanted to find something that had a little bit more variety.
I actually could see myself doing that.
Uh-huh.
I really like the OR, but I wasn't in love with it, and
Okay,
so that little hint of doubt was there.
got
Um,
it.
and
So
then
what
just
was it?
really
What? Because 'cause you're saying that you were passionate about it, you said you really loved it, you could see yourself, so I'm trying to figure out when you were within that first 3 days of rotation, what made you feel like you were making the wrong decision?
I think it was my coworkers, actually. It was the
Okay.
other residents, it was, the attendings, they weren't nearly as intense. Um, they had great personalities. We didn't really talk about medicine. We talked about life and fun and traveling and, biking and hiking and climbing, and I thought, "Oh, I think these are actually my people."
Mm,
Um the other thing I really liked was the team effort and the collaboration that goes into emergency medicine.
got it.
Um, I've done the, 12-hour shift on your own thing, in the ER, and I don't care for that. I like the team collaboration where there's, like, a bunch of docs, a bunch of nurses, a bunch of techs, a bunch of clerks, and it's like a puppy pile, and we're just cranking it out. Um
Got it. So your rotation was in emergency medicine, which is what made you fall in love with in love with it, in which you decided to actually switch. Got it. Got
Yeah.
it.
Yeah,
Okay, cool. So you saw yourself in in that environment through makes sense.
I did.
So, to go back to the moral injury, and I know that happened to me in my career. I actually come from the pharmaceutical industry. And
Oh, okay.
so you spoke about the microaggressions, which is essentially, impacting you as,
Mhm.
the physician and a person and a Black woman. What did you have any thoughts or resistance around the way you were providing medicine that impacted some of your values and your beliefs?
Oh my goodness. I mean, so I've been doing this for almost 30 years. The changes that I have seen in how I'm able to advocate for my patient, the way I'm able to treat my patient, the way I'm able to test my patient. When I first started, there was hardly any blowback. I mean, the only time radiology would call you about an order that you made was if they didn't understand it or if they thought, "Oh, maybe this might actually be better." Um, Now it's, "Yeah, you've ordered too many of those. Oh, we're not doing those today. Oh, their insurance isn't gonna pay for this." And it's like, "What are we doing? I am an experienced physician. This is the test that my patient needs. I'm not ordering it for frivolity or to spend money that doesn't is unnecessary." Um, and I feel like that has just gotten worse and worse. The oversight is insane, and it drives a wedge between the patient and the provider because I say, "Hey, this is what I'm seeing. This is what I think we should test for." And then I order the things and then I'm told no. Or I say, "This is what I found and this is the treatment that we're going to go for." And then I'm told that that prescription isn't covered. This is too expensive. This needs a prior authorization. Um, And that has gotten just exponentially worse in the last couple of decades. And then to have, the patient satisfaction scores constantly pounded into you about, nobody likes you. And so you didn't make best friends and I'm like, I'm not here to make friends. I am
Right.
here to actually treat patients well.
Mhm.
And I do that. Um, and so the constant barrage of oversight and paperwork, um, has really ruined medicine for everyone involved, except the people who are greedy and getting paid for all of it. But the patients are losing out big, big, big time. The providers are exhausted and completely spent. And then that's only if you're a rich white guy. Like,
Mhm.
you add into the fact that I'm not a rich white man. And people are like, Dr. Croghan, the patient in room 7 won't leave because they said they did see a physician." I'm like,
Mhm. Yeah.
"Well, I was in there 4 times and I stuck my finger up their butt, so they should probably know that I'm their physician."
Right.
And so I'd
Right.
go back into room 7 and be like, "The nurse said that you had a question?"
Right.
And you just see the light, like, slowly go off, like, Oh, that hurts. That hurts." And when that happens, like, once every 6 weeks for 2 decades, I
Yeah.
kind of am over it, and
Mhm.
it's not any better with the staff where, "I can't find the doctor, I can't find the doctor." I'm like, "I'm standing right here." And then,
Mhm.
oh, consultants, same thing. I consult people and they wouldn't believe I was the physician or they would talk down to me and disrespect me. I'm like, "I've been here 10 times longer than you. You just got out of residency." Like,
Yeah.
I do know what I'm talking about. Um, and so that made things even harder. It's just like I'm already slogging through mud and getting my soul wounded on a regular basis, and then I'm not even recognized for who I am.
Right.
It got
Now,
heavy.
there's a lot of Black women in general in all different type of industries that are experiencing something similar to you, right? And
Mhm.
or what you've experienced, but don't necessarily have the tools to navigate a transition out of this type of environment. What do you think it was about you and your mindset that thought to yourself, like, I'm going to figure it out no matter what?
I think the pandemic just forced my hand.
Mm,
I do think that, I was lucky and I'm ever gratified by the fact that I was set up to be able to financially do some moving around. Prior to the pandemic starting, a friend of mine, from medical school, she and I sat down for a beer. She had just had a baby, and, I was like, "What are you doing now?" Because she had been working in our same system, and she said, "Oh, I'm working for Grand Rounds. It's this telehealth gig," and she told me about it, and I was just in awe. I'm like, "This is actually how medicine should be
Mhm.
delivered to patients. This is such a beautiful thing." And they were hiring, and so I would say 6 months before, the shutdown, I started working for Grand Rounds online. And so I decreased how much I was working in the emergency department and started increasing my hours with Grand Rounds online because it made me happy to be able to treat patients that way. Um, then the pandemic hits, I land on my face, I increase my hours with Grand Rounds and just try to see if I can go to therapy, heal my soul, and get back to the department. Um, that never happened. And so then I kept doing more and more telehealth. And so I was basically just augmenting, what I had lost from leaving my career with working with telemedicine. And people are like, "Do you like it?" I still like treating patients and I still like being able to help people and hear their story, but it's not like being in person, and I like putting my hands on people. Um, and so in that way, there's a loss of satisfaction, but I've been able to be home for my kid a whole lot more. He just graduated from high school. I feel like I've had a lot more flexibility to go to his shenanigans and be around the house for when he wants to spill the tea.
Mhm.
That's been
Yeah.
really lovely. Um, and so I've taken a huge financial hit, I won't lie. But it's been worth it for my quality of life and for my sanity. I just was not
Sure.
psychiatrically faring well, and I
Right.
didn't even realize it.
Right. And I want to go a little bit deeper on that. When you were finally able to step away, then that's when
Mhm,
you realize that, okay, like I need to start taking care of myself. Right. And you
mhm.
mentioned really diving into therapy to really heal your soul. Do you feel comfortable kind of touching on some of the things that you uncovered through your healing process?
Whew. One of the biggest things was, so I had been seeing this therapist off and on for probably 10 years before this happened. She'd taken me through marriage, divorce, baby, career, all that stuff. So she knew me very well. Um, but even when we were still doing telehealth, when we were on lockdown and she knew what I was going through, she started doing some EMDR with me. Um, and it's like a tapping and eye movement thing that's supposed to basically dial back your nervous system's response to traumatic things. And so she was taking me on a drive near the hospital. And I am not a woo-woo person. I was kind of like, yeah, we're going to try it, whatever. Um, I actually got stuck in my mind across the street from the hospital staring at the parking garage, and I couldn't go north, south, east, west. I could not go anywhere in my head. And she's like, "Let's just keep trying to go." And I was like, "Mm, I cannot." And this was because I had realized that I couldn't drive on that street, Bianca. Like, I would drive around that particular hospital. And I had been in cars, either Ubers or friends who were driving me, who had driven on that street, and I would actually sweat and have palpitations and feel nausea, and I had never had that in my life, and it was maybe the 3rd time I was like, "Oh, I'm anxious. Oh, this is what anxiety feels like," because as an emergency physician, like, you put that on lockdown, there's no such thing as
Yeah.
being anxious. And so I was like, "Oh, that's kind of interesting that my nervous system has calmed down enough that I can actually recognize anxiety coming up instead of just living here all the time."
Right.
Um, but so she and I talked about what's going on across the street? Like, what are you looking at? And it was I had had a bunch of back procedures up the street. They were extremely painful. Um, we had had a fatal physician shooting in that parking lot, and I had been on that day and taken care of some of the victims. The emergency department speaks for itself. And I was in the parking lot where my son had gone for a very scary health procedure. And I didn't even realize in my head until that moment that all of those things were working at that geographic location. And I think my brain was like, that's not a place that we go. We just
Mm,
can't move there. Um, and so she really helped me have insight as to where I was so stuck, um, where the trauma was coming from, things that I needed to address. And um, it was vital to my happiness and to my success with my own sanity because I was not doing well, and it was so big and so unwieldy, I didn't even understand it myself. She actually watches what your eyes are doing, because it gives her feedback as to what's going on with your brain, what you're envisioning, um, and then so she was having me sort of drive slowly or walk in that area where I told her I couldn't drive anymore, um, and then she's there to support you, positive affirmations, all that kind of stuff to kind of keep things quiet.
mhm,
And then once you get stuck, um, prior to all of this, she basically asks you to describe what your happy place is. Some place that you feel completely at peace, your skin feels good, your body feels good, you're looking and smelling and tasting things that are good. It's kind of an overall sensory, fabulous place. And so then when you get stuck, you get to go back there. And so she kind of toggles back and forth. And my understanding is maybe that eases things. And also, it's a safe place to go when you're visiting something that's really scary or triggering. Um, and the other thing is you do some tapping. She in person, she'll also have like a little um stimulating thing on your finger that gives you little clicks. And I think this is your brain focusing on that instead of what your trauma is, and doing some neural rewiring, actually.
mhm.
Um, since it was during the pandemic, we had to do the other thing, and so I would just tap myself rhythmically when she would ask me to. And so it's something that you can actually do at home. Like there's apps and people will walk you through doing EMDR at home, to help with this. And so the idea was really deeply exploring where the trigger is, what the wound is doing, how you feel, what your, physical sensations and reactions are during that time, and then overriding it with the tapping or the clicking and taking you to a safe space and giving her the understanding of what's going on in that moment so that you have lots to talk about and pick
Mhm.
apart to try and figure it out. Um, and it doesn't erase it. It's not like hypnosis or something like that where all of a sudden you just, "Oh, it's totally fine."
Yeah.
It's not like that at all. It's just instead of it being like a 9 out of 10, like, "Oh, I just really can't do this right now," and the sweating and all of the physical manifestations of anxiety, it just turns it down to like a 4, where you're
Mm,
like, "This is still uncomfortable, and I realize I am in a spot that I don't like, but it makes you more functional." And then on your own, I think it just kind of softens and softens.
got
Um,
you. So she's
yeah,
actually working on dialing it down during the actual EMDR process.
correct. Yeah.
Did you choose exactly where it is you wanted to go, or is that just what came up for you?
I think must have already told her that I realized I can't drive on those like 3
Got it.
blocks
Okay.
of
Got
town.
it.
And I was like, there's something that's really weird. And we had done EMDR on a few other things, a really bad patient outcome, a catastrophic romantic breakup, things like that. And so we already knew that it did work fairly well on me. I kind of thought it was crap to
Yeah,
begin with. I was like,
I
this is
wanted to go into
ridiculous.
that as a physician. You said you're not really woo-woo, right? And like I'm working with a physician who's studying functional medicine, and she's like, some of it I agree with, some of it is going off a little bit of the path for me. So, you were a little skeptical, but after the experience, what do you think about it now?
I think it did exactly what it was supposed to. I'm wary of driving on that street now. Um, but I can do it. Like I don't I I double check myself. Are we good? We're good. All right, we're good. But I used to not like I couldn't even look out of the window at the hospital. It was like I cannot do that. That doesn't happen. And so it just has softened it, right? Like I don't get the physical manifestations of anxiety as I'm driving on that street anymore. I don't fear like, oh, I'm going to have to go by there in order to get to wherever I'm going. I don't have that anymore. There is a consciousness of this is the spot, this is the place. Um, but it's functional now. It doesn't feel as pokey.
Got it.
Yeah.
Interesting. Thank you for sharing that.
Mhm. Yeah.
So, it's beautiful that you actually were conscious enough to go into healing, probably to heal many other things along with your workplace trauma. And we often don't hear about, we hear about traumatic and toxic workplace. I think it's very prevalent in the conversations today. But we don't often get to hear about the actual stories through the healing process because most of the time they're just trying to either cope with it or just figure out a way to get out of it, switch to another job. So we not realizing that these are years and years and years of trauma that actually needs to be healed just like any other trauma in our lives. Is
That's
there
right.
any other life event that happened along your journey in transitioning out of the hospital that really caused you to kind of question where your life was going?
Well, when I think in the week leading up to my leaving, um, my son was going back to middle school. He was at a charter school, and the principal was making very poor politically motivated decisions as far as our kids' health was concerned. Um, and that was freaking me out, frankly. Um, my parents had just moved into town, from far away, and so I felt the need to care for them and entertain them because they didn't know anybody here, and I was unable to do that because I was afraid of, frankly, killing them
Mm,
with COVID.
yeah.
Um, I was living with a boyfriend at the time whose son was staying home from school, was, learning from afar, and he had left his job, to work he had left the office to work at home, and so I was the only one home who was gonna be regularly exposed to the virus, in addition to my kid, and so we decided that was too dangerous, and my kid went to live with his dad. And I didn't see him for 3 weeks. I didn't see my parents for 6 weeks. I didn't see my son for 3 weeks, and I was like, "Wait a minute. Like, I'm super unhappy at work. I just got called names. I got called the N-word today for taking care of people. Someone threw something at me. Like, I I'm done. Like, I can't even take care of myself or the people I love, and I'm getting just blowback and super bad aggression and ungratefulness. Everyone was scared, and I get that. Everyone was on their worst behavior.
Hmm.
Um, but it coalesced into, like, I'm losing touch with my kid, I'm losing touch with my parents. I was very worried about my parents' state of affairs and their health at that time as well. And so it's kind of that sandwich phase of
Hmm.
life came to, like, a major head. Like, I am raising my child badly, and I'm also not there for my parents badly,
Hmm.
and I'm not taking care of myself. And this was all sort of middle age. I was super perimenopausal and didn't realize it. Um, so I think all of that together was the perfect storm for just, "Uncle, like, I can't anymore." Yeah,
Got it. And how many years were you in emergency medicine?
26.
26 years. And so
Yeah.
it's interesting when you chose emergency medicine, you were looking for that variety and I want that, constant changing environment and excitement and things of that nature. But as time evolved, things change and you realize like, okay, this ultimately doesn't fit the vision that I had to begin with. And one of the reasons I call my company Recalibrated Vision is to give us
Mm,
permission to change. Even when you're in a high achieving, high functioning career, it doesn't mean that you have to stay stuck in this identity that is no longer serving you. It served you while it did, and now you're to the point where it's time to evolve. And, it's okay to give yourself permission to do that. Because I work with a lot of clients who seems like they're looking for validation, or they're looking for someone else to give them the permission to actually leave instead of just giving it to themselves, right? So thank you so much for sharing that. I'm going to shift a little bit. Um, so I know in emergency medicine, you've probably seen it all, right? And I know that you're currently a podcaster, and one of the things that you advocate for is sexual health. So I know we have conversations around protection and, taking care of yourself physically, but how does sexual health impact us from like a mental or emotional standpoint?
Honestly, that's where we get all our happy juice from. Not
Yeah.
all of it, but um, it's an easy, free way of getting happy juice without medications. Like it's your own natural yumminess. Serotonin, dopamine, oxytocin. That's the only way men actually get oxytocin. We have other ways of getting it,
Hmm.
especially when you're lactating, but it's a
What other
lovely
ways do we get it
thing.
that men can't?
When we breastfeed and part of the time when we are, giving birth. So, I mean, it's fleeting and a small amounts and it's fleeting, but we know what that feels like, and it can feel really amazing, and it's like this dreamy goodness. Men don't get that except after an orgasm, the snuggling afterwards when they get really cuddly, that's what they're doing is they're soaking up oxytocin, which is awesome. Um, and so I have taken an adventure into polyamory the last 3 years. And so I have been learning a ton about sexual wellness and health and diversity. And it's amazing to be this age, have the exploration, the curiosity, learning new things about myself and other people, and
Hmm.
having this open-mindedness and ability to not judge. Like, there's
Hmm.
plenty of stuff I want nothing to do.
Hmm.
That is not my thing. No, thank you. But to learn about it and hear
Right.
other people's stories and the fact that it makes them happy and that's how they get pleasure, that's huge to me because I'm in my second half of this life, and I think my priorities have changed so drastically that pleasure has really climbed the ladder to the point where it's like, if this isn't making me happy, it probably needs to stop.
Mm.
Um, and so sexual wellness is part of that, in
Right.
that I want to be able to help people achieve that as well.
I love
Um,
that. So,
yeah.
when you chose polyamory, so did you have a partner at the time?
I did not. I was single.
Okay.
I had just gotten out of a really good monogamous relationship, and I'm like, "I'm doing something wrong. I'm either picking the wrong people or I'm the wrong person or this is I don't know what is going on." But yeah.
So, what was the conversation you had with yourself when you decided that you were going to explore this alternative lifestyle?
I had a good friend who I consider a life mentor. She is about 9 years older than me, um, hardcore badass businesswoman who has also changed her career big time. Um, and she had gotten into polyamory pretty late in life, and I did not understand it. I didn't get it. And I kind of been picking her brain a little bit for years before that, mostly because I was concerned for her.
Mm,
Um, and then she actually came and stayed with me for a few days, and all we did was talk about, like, why and how does this work and how does it make you feel? And,
mhm,
by the end of it, she was like, "Just make a bunk profile and get out there and look around and
mhm,
see if it calls to you." And so that's what I did, and I just found that people's emotional intelligence seemed to be a lot higher. I loved the transparency and honesty that came with ethical non-monogamy because people have learned how to communicate better
mhm,
about what they want, what they're doing, what they're looking for, what they're not looking for,
mhm.
what their relationships are with other people. And I think I love human behavior, and so I was like, "What are you doing? That is
Mhm.
amazing."
Yeah.
And so even just talking to people and getting their story and learning about new people and meeting so many extraordinary people, whether it goes well or not. Like I've made a bunch of friends that I'm just like, this is great because I don't have to filter myself. We can just talk about anything.
Yeah.
It's freeing.
I can imagine. So, what would you say to someone who is like, well, she mentioned that she had a tumultuous divorce. So perhaps she's just very hurt in this space and looking for other ways to heal through this new lifestyle versus actually going the traditional method.
So my divorce was 16 years ago.
Okay.
Um, and even though it was hard, it was difficult for all the usual reasons, and especially because we had a small child. Um, but we're still friendly. He lives half a mile from me. It was not contentious. We didn't even need lawyers. Like our
Mhm,
divorce was actually really smooth. Um, and yes, I have had several failed monogamous relationships since then. Um, and I wouldn't say that those failures led me to just be like, I can't be monogamous anymore.
mhm,
If the right person and situation came along, I would be fine with monogamy again. I mean, I did it for 40 something years.
mhm,
Um, but polyamory has allowed me to explore some really interesting people, get into different desires that I have,
mhm,
enhance my emotional intelligence and communication like 100-fold.
mhm,
Um, and it's helped me to reflect on some of the mistakes that I've made and some of the challenges that have led to the demise of my monogamous relationships up till now.
mhm,
Um, and it really almost all stemmed back from communication and the lack
mhm,
of it, fear,
mhm,
shame,
mm,
um, and not being honest and open. And sure, there's monogamous relationships that have all of that in spades and
mhm.
right on. Um, I was not having that experience and I own my part of that as well. I didn't know how to talk about what I wanted, or what was hurting me or what was scaring me or about my shame. I had no idea how to even discuss it.
So, so they're more emotionally intelligent. Would you say you felt safer having these conversations with multiple people than you did in a monogamous relationship? What is it about the communication that changed from one person to multiple individuals?
I think I learned from people being open with me that I was like, "Oh, yeah, I'm not judging this person. I don't think they're dirty or disgusting or wrong or any of those things that I was afraid, that gave me fear to admit my desires or my feedback or anything like that. I just wouldn't talk about it, and I like to
Mhm.
talk.
Yeah.
Um, but I think that we live in a very puritanical society, that shames nudity and talking about your desires and what you want and what isn't good for you. Um, and so I think it's also part of my generation. Like my parents never talked to me about any of this stuff
Right.
ever.
Right.
And so I feel like the younger generation is far more open and sex positive and better to communicate what's going on with them.
Mhm.
And so this was the only way I was going to be able to learn how to do that. Um, and it has definitely like there's been pain. I've fallen in love. I've broken up with people. Um, I've gone from being someone's partner to just having them as a friend. Um, which has been such a beautiful thing because there's this freedom in not having to explain yourself nearly
Mhm.
as much. Like this person already knows you like intimately and very well. And so when you pick up the phone or text them, they have a great poster board of what is already happening with you. Um, and I just find that ability to be honest and communicate really openly and freely. I was not doing that in monogamy. And, part of that is on me. Um,
Right. I think it just gives you a
yeah.
fresh perspective, and I always say, like, in any relationship that you choose, you should always feel free. Always you should
Mhm.
always feel free. And that's how I define on whether or not a relationship is for me is the feeling that I have whether, I'm monogamous, but in this container, do I feel the freest I've ever felt? And do I have the freedom to be myself? And ultimately, that's what I'm looking for. But everybody could be looking for different things. Because I know it's natural to think about the sexual component, but I can imagine that there's this deep, connection with all of these different peoples. And like you said, it's really about exploring yourself because when you engage with multiple people, you learn different things about yourself through them, right? And
Yes.
so it really is a beautiful journey. And then you're building these connections along the way. I think that where I would create resistance is how do you manage it should be free flowing, so there shouldn't feel like you have to manage like these type of connections, and then you can you should be able to let yourself experience all that there is. But doesn't it how do you is it like a emotional overload? Like how do you manage all of these different connections? Like how do you filter through that?
It can be. It it can be overwhelming, depending on how many people you're dealing with. Sometimes it's just one, which is
Mm,
fine, but, like, maybe you're both looking for other partners as well.
mhm.
Um, and then sometimes you get what they call polysaturated, where you're seeing, like, 2, 3, 4 people, and it's like, "Well, I don't have time. I don't have time for
Yeah.
me. I'm not spending enough time with you guys." Um, and so sometimes you do have to take a step back, dial it down, and it ebbs and flows just like anytime you're dating, right? Like feast or famine. Financially, romantically,
Right.
professionally, feast or famine.
Right.
Um, and so the same thing happens in polyamory. And sometimes it can be too much and you do have to, take a step back. Um, and they're obviously seeing other people too. And so sometimes they have to explain, like, oh, this partner is really having a tough time and I need to really focus on them and I will be back. Um, I've had that happen a couple of times and I've had to do that a couple of times as well. And I think that's part of that freedom of communication where there isn't a bunch of judgment there. It's more leaning into being supportive and loving and helping people, and it's so bizarre, like, you end up having this full-on village of people who care about you, and it's, like, the people that you're dating and sometimes the people that you're dating that they're dating.
Mhm.
Um, when I was really sick at one point and I had just had surgery, my partner's wife came and brought me, like, a bunch of meals.
Wow.
"What?"
That's good,
So she
that's
was
cool.
food prepping and she was like, "Oh, maybe Carrie would like this and that." And so,
Yeah,
she brought this over and I'm in a big sling and she helped me put my ice on and we chit-chatted for an hour and she took off and I, like, was just marveling afterwards.
that's
"What?"
interesting,
"Wha
that's really interesting. And
Yeah.
so when you mention ethical, is that just, is that just referencing, like, the communication part is just you're always transparent and honest about who it is you're dating and connecting with? What makes it ethical?
Right. So, ethical and consensual are being interchanged. So, it's either ENM or CNM.
Okay.
Um, and it just means people are not cheating. Like, everybody knows what's going on. So, if I am dating someone who is partnered with someone else, everybody knows. Whether we actually meet each other or not is completely different because relationships all have their own rules and regulations, and you set it up per whatever is appropriate for that relationship and everybody involved. Um, but the idea is nobody's cheating. Um, and so if somebody is partnered with, both partners know what's going on. Um, and so that's the ethical consensual part.
Mhm.
When people come at me who are like, I'm in a loveless, sexless marriage and I'm just looking for something on the side, I'm like,
Yeah,
nope,
right.
because if she doesn't know what you're doing, I am not part of that. And I understand that you're in a super bad situation and that sounds terrible. And I'm sure that both of you are hurting really badly. You guys need to talk and sort it out.
Right. And I
Um,
guess that's what this lifestyle gives you. It's almost like it just like a pre-qualifier. It's like you know that this is and they you everyone already has an open mindset. So when it comes to
mhm,
things like this, you can have that open dialogue. Whereas if you're in a marriage where you're unfulfilled or unsatisfied and you don't have, the type of relationship where you can have the dialogue to say, I'd be interested in engaging with a partner outside of us or things of that nature, or what it would do to that relationship,
mhm,
that's where cheating, I would imagine, starts to take place.
right.
So it's really nice to hear that there is some type of, boundaries that are set in place and really, pursuing a lifestyle like this, which is essentially what makes it ethical, right? What rules and regulations or non-negotiables do you have for yourself?
For myself, like, absolutely no cheating. Um, and I don't like just I don't like anything that's not going to be a long-term recurrent situation. I identify as sapiosexual, and so I have to have a brain
Same,
connection
yeah.
with somebody.
Mhm.
Um, and so I'm not just gonna like first day, like hit it and quit it. Like that's not
Mhm.
what I'm looking for. I don't care what you look like. Um, and so those are some of the rules that I have for myself is that I really need to feel a neural connection with somebody, like, we have to make each other laugh. I have to respect your brain and feel that you respect my brain as well. And I have to know that logistically, I'm gonna see you on a regular basis. Either we're local to each other or we are traveling in each other's areas on a regular basis. Um, because I have to have that stability and comfortability with someone. Otherwise it just doesn't really work. Um, So those are some of the rules and regulations that I need to feel comfortable enough to engage with people and let them into my life. Um, yeah.
I like that. And so you said you weren't a woo-woo person and then now you're doing EMDR. Then you are starting to explore an alternative lifestyle. Is there any other spaces in your life where all of this, open-mindedness started to kind of flow into? Like, are the other things that you started to rethink? And where like maybe I'm a little bit more flexible when it comes to this, or I started to look at this a little bit differently.
Oh, are you stalking me? Good lord. Yes, I have gotten very woo-woo lately, and I laugh at myself all the time. So I've done several sound baths, and the first one I had was in a room, this beautiful, gorgeous, luxurious room, but there were probably 30 or 40 people in there, and I was like, "This is ridiculous."
Yeah.
And I'm laying on my back, and it's really loud, and I have some sensory integration issues with certain tones and certain volumes, and I was like, "Oh my god, I might have to leave. Like, this is
Mhm.
not I'm not gonna do this well." I was dead asleep, Bianca, like, I was dead asleep. I woke up probably 40 minutes later, so refreshed, but still so just chill and, like, everything just felt warm and delicious and calm, and I'm like, "I'm just gonna go straight home and feed the dog and go to bed." It was one
Mhm.
of the best night's sleep in 3 decades. Um, so I've done that a few times. I also have seen my own functional medicine physician, for some of my own health problems, and ironically, she's an emergency physician and who's now doing functional medicine, and I was
Mhm.
like, "Awesome, we get each
Yeah,
other."
right.
Um and I'm going to some goddess circles. So women coming together and being kind of witchy and journaling and lighting candles and really diving into a lot of our spiritual being, exploring our own wounds, doing shadow work. I've
Mhm.
been doing that for about a year and have really enjoyed it much more than I thought I would. Um, so yeah, I've people have done some Reiki on me, and I'm not sure how much I've gotten out of that, but I don't hate it.
Right, right.
Um, so these are things like 5 or 6 years ago, I'd have been like, "Oh my god, what a total waste of time and money. What in the
Yeah.
actual hell are you doing?"
Right.
And now I'm like, but it makes me feel good and it makes me explore myself a lot more than I ever did or ever would have. So I think it has improved my quality of life. And so I'm going to stick with it, woo woo or not.
Yeah, absolutely.
Yeah.
And it's funny because you mentioned like when you were in the ER, you were trained and conditioned, you were conditioned to stay at this like anxiety level. So that was normalized for you, right? So any
Yeah.
engaging in any of these type of activities would almost take you out of that conditioning, and it would almost feel like, yeah, that's a waste of time. Like I need to focus, I need to go to work, and like this is where you operate. So now that you're starting the healing process and you're starting to open yourself to all of these different things, it's almost like it's a place that feels, you feel safer, more sacred to be able to allow your body to really experience this type of peace and healing and
Mhm.
tranquility. And it's like, wow, like years ago, like you wouldn't the thought of doing this just feels like a waste of time, and now it's essential to your self-care.
Yes. And I have redefined what self care is.
Mhm.
Before it was like the work 10 out of 12 shifts and then go on an 8-day adventure and then come back and work 12 out of 14 shifts because you had to make up for what you just missed. Like it was just
Mhm.
like super pounding. Um, and part of it was amazing.
Mhm.
I mean, I loved those trips and I loved to be able to just completely unplug. Emergency medicine is really great for that because you don't have continuity of care. Like once you leave the department, we
Mhm.
done, we gone. That's
Right,
it.
right, right, right.
Um, and that's not how it is, obviously, with podcasting, with my own patient care panel right now. Like, I get calls from pharmacies and I need to follow up on labs and I need to, these patients are now my patients, which is new and different, but also really exciting and lovely because I get to know them more in depth and more deeply and intensely. And it's more gratifying in a lot of ways to have my own
Mm,
patient panel. But yeah, that like just having your foot on the accelerator 24/7, 365, whether it's at work or at play, that was
mhm.
aging me in really
Yeah.
bad ways. And it's interesting because when I run into or hang out with my old emergency folks who are still moving the meat, God bless them,
Mhm.
they're like, "You're aging backwards.
Yeah,
Why do you look
yeah.
like what is going on? You look so good." And I'm like, "No, I'm not shattering my soul on a regular basis. Like, I am able to take care of myself and I know what that looks like and I'm able to like enjoy taking it down to first gear and cruising for a little while. It's okay. Like I'm still a bit of an adrenaline junkie, no doubt. It's hard for me to just rot on the couch and do nothing, but it's easier now than it used to be."
Right, absolutely.
Yeah.
So you mentioned, let's like kind of move into what you're doing now. So you mentioned that you help people kind of integrate or transition into polyamory, but you also offer other health coaching and services for people in general. So kind of talk to me about what you're currently doing now.
I think the majority of my patients see me for care coordination. So they're in the healthcare system, they're seeing, their primary care and or a couple of consultants. They don't understand what's going on. They're frustrated. Everything is very fragmented and fractured, and they just don't even know what the plan is. Like, what is my diagnosis? What does that mean? What am I doing going forward? What am I supposed to do next? And
Mhm.
so we'll hop on a 50-minute meeting. Like, when's the last time you had 50 minutes with a physician?
Right.
That's
Right.
like never ever.
Mhm.
Um, and so just really getting into the nitty-gritty and the details and how they're feeling about things and how they're frustrated and lost. And then by the end of it, they have a better understanding. They feel heard, they feel seen. We've got a plan of action, and they're like, "Oh my god, I finally get it. Yes, please, and thank you."
Mhm.
So that's one of the things that I absolutely love because that's actually what I did at Grand Rounds too, that I just fell in love with was
Yeah.
advocating for the patient and just putting it together in a package like, "Here, this is what's
Mhm.
happening," instead of you trying to figure everything out.
Yeah.
Um, I'm doing a lot of hormone stuff for women who are perimenopausal, menopausal, um, and that's huge, and thankfully, there's more and more science is coming out that treating perimenopause and menopause earlier is better. Better
Mhm.
for your bones, better for your heart, better for, like, oh my gosh. Yeah, it's coming
Mhm.
out that the longer you wait, like, I didn't treat myself for 8 years. It's not like I didn't know what was going on. I was like, "Eh,
Mhm.
yeah, whatever, it's natural, it's not that bad, meh, meh, meh." Turns out that those 8 years, I screwed with my bones, and I may never get that back, and I worsened the possibility for cardiac problems later in life. Like, I
Mm.
put myself at more risk for having a heart attack later. What the heck? Like, just
Yeah.
treat those symptoms. So, I'm talking to a lot of women who are frustrated with that, and it's a struggle. Um, so those are the major things. And then also, as you said, like mental, sexual, and physical health. I can do quick urgent care stuff, hop on with somebody. Hey, do you think I need to go in and get sutures for this? Like, I just save them a copay. It's easier for me to just see them like this
Right.
than them to actually go wait in line, pay 80 bucks and not have anything done. And I've
Right.
been doing that for friends and family for 30 years. "Hey, Carrie, what do you think about this? Do I need to go in?" And I'm like, "Oh my god, yes, don't wait another minute."
Yeah.
Um, and
That's actually really
so
yeah, that's really valuable. Wow.
yeah, I'm the go-to person. Like, send me a picture, let me take a look at it, stop by my house on the way to the emergency department. I've done that several dozen times where I'm like, "Stop the car, turn around, come to my place, let me take a look at it. You don't need that. Like, you don't need to go to the ER." Well, that just saved you hundreds of dollars and, like, 6 hours of your life. Um, and so that's something that I love doing via telehealth because I can give you really quick advice. Ta-da! Um,
Great.
yeah, STI
Awesome.
testing, super easy. I'm gonna get into PrEP and PEP for, HIV prevention. Just waiting for those people to hit my door. So, it's gonna be like it's been really fun, and I look forward to a ton more.
I love that. Um, on your podcast, I was on your LinkedIn and, we've had a lot of conversation in relation to like healthcare, but there's other conversations that you're having. I noticed there was one that where you were interviewing a young lady who was talking about healing trauma after her mom, you know, recovered. Was it from drugs?
Mhm.
Yeah, from addiction.
Yes.
So what other things are you passionate about talking about for your podcast? Because I want everyone to know not only are they getting the healthcare, but you go a little bit deeper in that as well.
Yes. Um, so Delasia was the young lady that I was speaking to, who ended up in foster care for several years as a child because her mom, was in rehab for addiction, and, she's amazing, but she realized when she got to college that she was having strange physical problems, and luckily somebody diagnosed her with PTSD, and so she is able to get treated for that, and, I have PTSD, and I have friends who have PTSD, and none of us have gone to war. None of us have been, like, fled from a burning building. We haven't necessarily been assaulted with machetes, like, the things that you think about with PTSD. It's so much broader, it's such a bigger topic, and I think until you name it and identify it, you can't really wrap your hands around it and tease it out and fix it.
Mhm.
Um, and so I was so proud for her and so grateful that she got that diagnosis early on so that she could tackle it, and now she can go into her adulthood knowing what's going on and realizing that some of her triggers and responses are more than they need to be and they're abnormal, and she
Mhm.
can sort that out. So speaking to her about being a woman of color in America, that could
Mhm.
go on for weeks. And I've had another woman on, and we talked about hospice and end of life, which is medical, but also very social and intimate. Um, she was also talking about her issues with hormones and having trouble finding somebody to understand what was going on with her, treat her, um, crazy libido roller coasters and things like that. And she's not perimenopausal. This is something that's just been happening with her since she was went through puberty. Um, so Yeah, I'm planning on doing a lot of healthcare stuff, that will be medical, but also socio-political.
Mhm,
Um, I wanna talk about men's health. I'm gonna be interviewing Dr. Watson, who does a lot with men's health, aging, and longevity, in a week or 2. And so I wanna speak to all genders. I'm actually having lunch with a guy today, um, who wants to talk about gender dysphoria, body dysmorphism, LGBTQ issues. So I hope to have him on in the next few weeks. And so I just want to be inclusive. I
mhm,
think that being in a place where you aren't judged and you can share your truth and explore your own adventure and bring that to light and share it, that's
mhm.
gorgeous, and it's just not being done very much mainstream, and especially not with a physician, like,
Right,
I don't wanna lecture people. You can get on the YouTube and find a lecture on
right,
anything,
right.
whatever, um, and that's necessary, especially if you need some quick education on this,
Mhm.
but I wanna do it differently, and I wanna do it warmly and invitingly and have people be super entertained and laugh and giggle and, drink a beverage of their choice while they're learning.
I love that. That's so true. I work with a lot of, physicians who feel like if they create an online presence, like they have to educate and they have to like live in this function as a physician, right? And a lot of physicians have other things that they have to say. And one thing I love about you is that you're so authentic with your voice. What
Hmm.
gave you the courage to get online and start to speak so freely and not feel contained to this box?
Um, I think because the boxes never fit. Um,
Mhm.
and honestly, like, emergency physicians tend to be weird and wild and
That is
not
true.
be
Yeah.
traditional physicians, like, Dr. Glaucomflocken. I don't know if you've ever watched him on YouTube. He's
Uh-huh.
hilarious, and
Uh-huh.
he parodies emergency physicians as always wearing, like, wraparound glasses and a bike helmet and a Patagonia vest because, like, that's kinda what's happening.
Yeah.
Um, so I think that that's part of it. Um, the other part is that I sit around with my friends who are also in the medical field, or they're attorneys or CPAs or physical therapists or whatnot, and we solve each other's problems. And it's almost like a panel discussion while we're drinking wine and eating crazy food and we're on our way to a concert, but we like solve stuff. And there have been so many times where like, why didn't we just record that? Like, we need to get this information out to people. And that's been going on for years. And so I think that was part of the like, I could help people solve their problems or at least get started on the right path by imparting information. And it doesn't have to be medical stuff and it doesn't have to be a dry lecture. Um, and so that's what I'm hoping is that people tune in and they're like, "Oh my god, I just learned 3 things and I giggled my pants off." Like, let's do that instead. I've been
I
to a
love
million lectures. Yes, I
that.
have learned a ton of things, but I've
Yeah.
also been like, "Oh my
Yeah.
god, like, how do I stay
Yeah,
awake?"
I just wanna showcase it just because you come from, a certain field, it doesn't mean that you have to get online and emulate, like, exactly, who you've been for the last 30 years. I'm sure that you have a voice outside of your career, and that is only a piece of you. There's other things that you have to say. And it's interesting you say, "I wasn't into the woo-woo, and now you're more open-minded." It's, like, I'm working with a psychiatrist who initially was going to educate around mental health obviously, and then healing without medication, which is extremely intriguing, and we were doing some work together, and I was trying to kind of identify her pillars, and I was like, okay, and then what else are we going to talk about, because I'm looking for that something that is stepping out of the box because I know it's already there. And so she was saying astrology, and I was like, okay, why do you feel like that cannot be one of the pillars? It's like there is a part of you that you want to speak on, that you have all of this information and knowledge on, but because you are a physician or because you're this or you're that, you want to save that part of yourself for you. but there's so many other people that can
Mm.
relate to that and could benefit that from that as well. And I want people to know that you're not the only one. Just because you have this title, this degree, doesn't mean that you can't talk about things that feel off the cusp for you, because there's other people just like you and you will find your tribe.
My gosh, yes. And
Yeah.
I mean, why not let your humanity fly?
Yeah.
I mean, that's how people relate to each other. You know,
Mhm.
I'm not trying to come at it like I'm the doctor and I know all the things. Um, I want to be like, I have experienced some stuff and I'm here to help you, but I'm also here to learn from you. And so this is a collaborative relationship. Um, and so if I can do that to the masses and then they come to me as patients because they're like, you know what, I really need to discuss this and that. And I heard you talk about it.
Mhm.
That's what I'm going for, is to really connect to people, um, and for them to realize I'm just a person slogging through it just like they are with wins and losses and frustrations and positivity, and yeah, at the end of the day, we're all human, and we have
Right.
so much more in common that than we don't, and so it's important to
Right.
remember that connection, and I feel like nowadays, especially with social media, that actually drives us apart. I wanna use that as some glue to bring us more together so that people don't feel lonely and alone and by themselves and like they're weirdos and
Right.
nobody's ever gonna understand me and I'm just gonna live in the shadows. I'm like, "Come on out. It's
Right.
sunny. People are gonna understand
Right.
you. Come on."
We're all the same. You know what's interesting is I want to get your perspective on this, because another conversation came up around perception and how they'll be perceived not by their audience but also by their careers or future employers. Do you think you would be as candid if you were still an emergency physician, because you're still operating as a physician?
Yes.
You would. Okay.
Well, I think so
Okay.
because I walk the world as a weirdo, right?
Okay.
Like, I'm 6 feet tall, my hair's weird, nobody knows what ethnicity I am, they can't like it's I'm a conundrum anyways,
Mhm.
um, and so it's really hard to pigeonhole me to begin with, and so I think and I've always been pretty mouthy and, it's only gotten worse probably because 'cause I'm in my 50s and I'm like, you don't like me? I'm not gonna be everyone's cup of tea."
Right.
That's just
Right.
not that's just not a thing, and I've learned that. But when I am your cup of tea, oh, it's really good, and it's really
Mhm.
fun, and it's really positive, and you're gonna dig it.
Right.
So, I think that's more where I'm at, where it's like, yeah, I understand that some of us are not gonna jive. I'm not here to judge. Let's just move on
Mhm.
without each other, that's fine. But if it's good, it's really good.
Right. Absolutely.
Yeah.
Absolutely. So early in our conversation, you mentioned that you took a financial hit, which happens to a lot of us that come from very lucrative careers, but chose our peace in our
Mhm.
souls. But you said that the biggest lesson you had was actually to rearrange your priorities and move out of scarcity. So when did you realize that scarcity was actually controlling your life, and what did you do to move away from it?
I think I'm still in that process, honestly. Um, so I think finding things that bring me joy that don't require thousands of dollars. Um, so I mean, I've always been huge on potlucks with friends, and they mean so much more to me now.
Mhm.
Um, because I think I'm more authentic and open, and that in turn makes my friends be more apt to, reveal themselves and be more intimate. And that's, dollars. It's not
Mhm.
thousands of dollars. Um, I had a really nice camper trailer that I just sold, and it's like, my kid's leaving, we're probably not gonna be camping very much anymore. The maintenance, the insurance, all of that is more of a hassle than it is
Mhm.
to, like, have this really pretty camper, and she needs to go out and have fun, and so she went to a lovely home, and she's gonna be all over Yellowstone all summer, and I'm super happy for her.
Cool.
Um, and I think taking, smaller trips, it's just more intense and more intimate, I guess, instead of like doing these big grandiose trips. Trust me, I still miss those a lot. and I will be I'm saving up to do some in the future, but, my son and I are going whitewater rafting for 3 days, and, we didn't go to the river that I would have wanted to go to if I was still making that kind of money. We are still going to have an amazing time in a beautiful place, and we're gonna do it together. So, I think it's just reprioritizing and also, finding the joy in some of the things that don't cost as much. Um, in my town during the month of July, there's a nonprofit organization that has arts and crafts and events all day, every day, the entire month of July. So last night was the opening night, and it's one of my favorite local bands ever got together again. And I think
Cool.
they've been broken up for like 10 years. And it was beautiful, and I danced, and it was amazing, and it was in the park, and it was like the perfect temperature, and it was free.
Perfect. Yeah.
What? And so, I think just looking around at the other beautiful options that you have that don't cost a ton of money, you'll find them. They're there. Going to a goddess circle for 3 hours on a Wednesday night for 25 bucks. Oh my god, it's so healing and so fulfilling, and you make these new connections with gorgeous people, and so my friendships have just expanded, and, um I think that brings so much more quality to my life than, jetting off to Iceland for 4 days and then coming back and working my butt off.
Yeah. Yeah, for sure.
Yeah.
Yeah, absolutely. You can definitely adjust and adapt. My personal transition and lifestyle changed dramatically, but that was by choice. So I
Yeah.
actually am a full-on nomad, and but
Ooh.
that was my initial intention before I started to get into this type of work, was to travel the world, and that was my initial goal. And then I was lucky to have the opportunity to find something that I love to do, and leverage my experience to actually serve others in the meantime. But, you'll end up finding a lifestyle that fits you, and it could look different for everyone. So,
Mhm.
even if you adjust in finance, because I think there's this misconception that like all of entrepreneurs have all of this money. I think that you have control of, the way you make money, how much you make money, and it's definitely a different experience, than having a full, paycheck. But ultimately you'll adjust and you'll find a lifestyle that fits you, and
Mhm.
you'll be just fine, because nothing is worth your peace of mind and, ultimately your life.
Yeah.
I don't like so I like to learn about the vision that people have for their lives, but I know when you're in this transitional space, I think that sometimes we put this expectation that we need to know where we're going, because that's just kind of how our careers go. Like, I'm gonna choose this career, and this is where it's gonna go. So my question really is just, do have you thought about the vision for your future? What do you have in mind, or are you really just steady focused on enjoying the present moments at this time?
I think I'm trying to toggle between both of them. So, I still have a job where I work for someone else, via telehealth, and I've been doing that. I've been with that company for over 3 years. Um, and they've been great, but I would also like to do my own thing. And so I would like my patient care platform to pay enough that I feel comfortable letting that go. So I'm hoping over the next 12 to 18 months to be able to do that. And so then I can see patients on telehealth wherever. Like, as you know, as a digital nomad, um, I'm a Cancer, so I need my nest, so I will probably always have a home. Um, but happy birthday month to me, by the way.
Yeah,
And,
happy birthday.
exactly. And, but I would love to be able to see my patients on our terms,
Mhm.
instead of working for someone else and having all that, like, insurance and paperwork and adjusters and Um, so that's my goal for that side. And then, podcasting and public speaking would be the other, business that I have. And so I would love to be able to share my experience and speak publicly, about a bunch of different things, but especially about the medical care system being really broken, and how that's affecting both providers and patients. And so those are kind of the next big hurdles that I'd like to tackle and be comfortable financially with both of those things. And I know that it's going to take a few years. I'm just getting started, but it's already so good.
Yeah.
I get to meet people like yourself and interview my people and talk with my crazy brother-in-law once removed, about dad stuff and sex and menopause. And um, it has just brought so much richness to my life, even if it's not monetary.
Yeah, for sure. And
So,
and
yeah,
and the mon and when you're doing things that you enjoy and you're finding joy in your life, not only do you get your life back, but then you also have the potential to earn even more than you were earning at the hospital, in the future. So that potential is always there. So how beautiful is it to be able to embark on another journey? It's there. It's happening. It's happening.
yeah, I love that. I love
Yeah.
that.
Awesome. Well, thank you so much for sharing your story. It was so beautiful, very impactful. Learned so much. Tell the audience where they can find you.
Actually, it's my name right here,
Hmm.
drcarryffs.com. That's my website. You'll find that you can book appointments with me. You can read my blogs. You can check out what I have to offer as far as podcasts. And so, Dr. Carrie FFS. FFS is for fuck's sake.
I
Um,
was wondering. I was like, I've never seen. I've seen so many little acronyms and titles and everything at the end of people's names. I'm like, I've never seen that one. Interesting. I love that.
Yeah, I worked in the soccer world for a really long time, both as a athletic trainer and as a physician, and that is what comes out of people's mouths on a regular basis that I've always sort of aligned myself with. And then, especially in the emergency department, there's you say that a lot, like either in a good way or like, I
Hmm.
don't understand what's happening or how you did this to yourself,
Hmm.
or I can't believe I can't get this done because the C-suite is not and the insurance company is fighting me. So then you
Yeah.
say it then. And now with sexual wellness and being polyamorous, you can also say it then. So it just kind of, yeah, came out for fuck's sake.
Yeah, I love that. So you brought I wanna know, do you miss the emergency room?
I miss that teamwork. And I miss there's not a lot of us who can do that job. Like it's a tiny percentage of us who can like do the trauma and the strokes and the heart attacks and the like all of that stuff. And I know that I have a very specialized set of skills. Um and so it hurts me that I'm not serving my community in that way. Um that's why when I left the first time I had to go back. It still chokes me up now because I felt like a quitter. Um but then I realized through friends, family and my therapist that like you've done a quarter of a century. Like it's probably, thousands and thousands of people.
Mhm,
You're probably okay. You've done your thing. And just realizing the damage that I was doing to myself and those around me by staying there. It just wasn't worth it. Um, so I miss serving my community. I miss being that skillful person for my patients. I do.
mhm,
Um, I realize that I'm doing that in a different way now that's much healthier for myself and for them. But I miss like the camaraderie and the team action and the craziness and the irreverence and the like it's a very intimate relationship to work in the emergency department.
mhm.
And you get to know each other a lot. It is not like other jobs. And I do miss that because I'm a voyeur.
Yeah,
I want to get in there and get to know you and be curious about
yeah,
everything. And so I do miss that part. But the pain and the soul shatter is not it's not worth it. I just can't do it
right,
anymore.
right,
Yeah.
absolutely. Well, thank you for your service of over When you said 2 decades, I was like, "Dang, that's a long time." You definitely look younger, so
Oh, thank you.
I know you're used to hearing that. But awesome. All right, well, thank you so much. It's a pleasure having you. Thank you guys so much for joining in this week. This is Recalibrated Vision, and I want you guys to always and remember to stay free.
Thank you so much, Bianca. It was a blast. Loved it.